Hello, my name is Adolfo.
Hey, this is Kenneth, and this is week 4 of the Pregnancy Monitoring Project presentation.
We will start off by describing how big the baby is at 4 weeks of development. The baby, also known as embryo for its current stage of development, is very small. It begins to take on a C-shaped curvature and it measures about 1/25 of an inch long. It has also developed a head and trunk. In addition, its arm and leg buds appear, and the baby's brain and spinal cord begin to develop.
What lifestyle changes should the mother take? During week 4, the pregnancy results should confirm as positive. The mother should prepare for appointments with a doctor to set up their first prenatal appointment around week 8. Even at week 4, it's never too early to start healthy habits. Try eating whole foods. No, not the market whole foods, healthy whole foods. Avoid smoking and alcohol, and if you aren't already, start taking prenatal vitamins. Exercise is also a great way to ease pregnancy symptoms and keep your body and baby healthy. Typically, any activity you are doing before pregnancy is safe to continue in the first trimester.
Next, what genetic testing is often done during these weeks? Is there a reason not to get this testing done before or after these weeks? There is no specific genetic test that can be done to the child at this stage of development, the 4th week of pregnancy. Most first trimester screenings are done during the 10th and 13th week of pregnancy in order to avoid the risk of miscarriage or any form of damage to the developing baby, especially during the 4th week when the baby is barely developing and any form of unintentional damage can cause severe problems. Nevertheless, the mother can get a DNA test to discover any hidden genetic disorders that she has that can be passed down to her offspring.
What parts of the baby are functional at 4 weeks? Not much of the baby is functional at 4 weeks since the mother's eggs had just been fertilized in the last 2 weeks. However, at this time, we can see that the embryo is about 1/6 of an inch long and has developed a head and trunk. The formation of arms and legs, which at this point is called limb buds, start to form. The brain develops into 5 areas and some cranial nerves are visible. The eyes and ears have begun to form. Tissue forms that develop into the vertebrae and some other bones, and the heart continues to develop and beats at a regular rhythm. There should be 3 layers to the baby: the ectoderm, mesoderm, and endoderm. These 3 layers will form the baby's organs and tissues. The ectoderm will become the nervous system, including the brain, skin, hair, nails, and mammary glands, sweat glands, and enamel for the teeth. The mesoderm will become the heart, circulatory system, skeleton, connective tissues, blood system, urogenital system, and the muscles. The endoderm will house the lungs and develop into the lining of the gastrointestinal tract, the liver, pancreas, and thyroid. The placenta has also begun to form and is producing some important hormones such as HCG.
Next, what will the pregnancy feel like to all involved parties during this period? The following symptoms will be experienced by the mother. Number 1, breast tenderness. The number of milk glands will increase and the fat layer will thicken as well. This will result in bigger breasts. Number 2, exhaustion and fatigue. That is caused by the increased production of blood that supports the baby with nutrients and by the increased hormonal changes that occur in the body. For example, the increased levels of progesterone makes you sleepy. Number 3, morning sickness. This is a common symptom that is experienced during the 4th week of pregnancy and it causes nausea and occasional vomiting. This is a result of the increased levels of estrogen and
human chorionic gonadotropin.
What tests or screening should be done during this time? An at-home pregnancy test should be done if the period of the mother is late or irregular. If the test comes back negative and the period is late, then wait a week before testing again. Preliminary blood work can be done to confirm the pregnancy and check for hormone levels, checking for HCG. HCG, which is human chorionic gonadotropin, a hormone that is present in the bloodstream as early as 10 to 7 days after conception.
Thank you for watching our video on week 4 of pregnancy. We hope you enjoyed it.